Hi, my name is Natasha Doe and my presentation is on Patient Protection Act. The Patient Protection Act, also known as Obamacare, was passed March 22, 2010 by Congress. Today I will bring to your attention just a few disadvantages that the Obamacare will bring about in the near future in the United States. Although there are some advantages, in my opinion, the disadvantages outweigh the advantages. Healthcare reform laws for many years have continued to be the #1 hot topic among the people in the United States. This law affects everyone, including children, seniors, and even the people in between. Since that day, March 22, 2010, the people in the United States have more to worry about concerning our future, such as the financial burden on us and our children, the value of health care, and the sacrifice of our freedom to make decisions to have health insurance coverage or not without consequences. The first argument I would like to discuss is the financial burden that would hinder us and our children. Because of this huge expense of the reform bill, according to the American Association of Retired People in the March 2010 press release by Bonnie M. Kramer, states that the Affordable Care is set up to focus on preventive care and to reform Medicaid fraud. The intentions that was in mind was a great idea, but they don't tell you that the reform will still cost the American family a lot of money. For example, a family that has a household income of $66,000 a year, which is slightly above average, the Obamacare will require you to spend 12% of your income, which is about $8,000 a year and $700 a month, in order to buy health insurance before any help from the federal government. There was a Speaker of the House of Representatives by the name of John Boehner that stated at his January 2011 press release that Obamacare is going to increase spending, increase taxes, and also destroy jobs in America. Not to mention that it would raise our national debt that would be left for our children in the future to deal with. My second argument is how the value of care would suffer, because there are going to be over 23 million uninsured people in need of care after the bill has passed. There have been policies put in place to train numerous residents and increase their supply. This fact is according to the American College of Physicians in the April 7, 2010 fact sheet titled Ensuring Adequate Supply of Primary Care. This was done through increasing funding, creation of primary care training programs, and by allowing residents to count time that wasn't accountable to count towards their residency requirements. What this fact sheet is implying is that they're rushing to push the residents through medical school, thus leaving the people with untrained physicians. Last but not least, my final argument is sacrifice of our freedom. According to an article titled Healthcare Reform 2013 to 2018 Employee Benefits, the Obamacare bill forces an individual to purchase health care coverage or face a penalty. For instance, for the year 2014, the penalty is 1% or $95 of their household income. And by 2015, the fine would have gone up 2% of $300.95 or $395 of their household income. Finally, by 2016, the fine could go up to 2.5% or $695 of their household income. To avoid such penalty, you either have to be in financial hardship have religious objections, or be an undocumented immigrant, or be under 100% federal poverty level. I thought it was against our constitutional right for the federal government to force an individual to purchase something. In my conclusion, the Patient Protection Act can be beneficial to some people in the United States, but we should not have to give up what we have to accommodate some. There are other simple solutions that we can think of instead of giving up our quality of care, not taking control of our debt, and giving up our freedom. The end.